Welcome to Shanxi University of Traditional Chinese Medicine. Today, we will study the needling methods of the three-edged needles. The three-edged needle is a needle shaped with a triangular head and a sharp tip, known as the lance needle in the ancient times. It is used to prick superficial vein for bloodletting. Firstly, scope of application. Pricking superficial vein for bloodletting with three-edged needle can stretch the meridians and collaterals, remote blood circulation to remove blood stasis, resuscitate the patient and expel heat. It is often used to treat senior syndrome and heat syndrome, as well as acute and chronic disease due to qi and blood stagnation in the meridians and collaterals, blood stasis, and exuberance of pathogenic factors such as high fever, loss of consciousness, convulsion, and scope, blood stasis in local region, and pain syndrome. Secondly, manipulations of the three-edged needle. Spot pricking. Hold the three-edged needle with the right hand. Prick swiftly about 2 to 3 millimeters in depth for bloodletting. The needle is withdrawn immediately following bleeding, or squeeze the punctured hole slightly to out several drops of blood. Then press the hole with a sterilized dry cotton ball until the bleeding stops. Clamping pricking. Prick a right unaffected small acquisition slightly with the hand or use cupping to drive decayed blood out. This method can remove pathogenic factors and stop pain. It is usually used for treating carbuncles and obstructive syndrome, etc. Pricking. Find the reaction point of disease first. For pricking, pinch up the local skin with the left hand. Prick about 2 millimeters in depth into the reaction point with a three-edged needle and push the needle up swiftly for bloodletting. Thirdly, causes of the three-edged needle. It is advisable to make necessary explanations for the patient. Sterilization of the area for operation must be done strictly. The pricking should be slight, shallow, and swift. It is inadvisable to induce excessive bleeding. Cares should be taken to avoid pricking the large blood vessels. It is inadvisable to apply this method to the treatment of the patients with poor constitution or pregnant women or the patients with susceptibility to bleeding. In this class, we mainly studied the needling methods of the three-edged needles, including scope of application, manipulations, and cautions. Please grasp them carefully after class. See you later.